In the United States, we continue to have new cases. As of this morning, there were 712, I believe, with 27 deaths. Guaranteed by the time of this evening, that's going to be up, and there'll be several more. And tomorrow, there'll be several more. So we realize that this is something, obviously, that we've been saying all along, that we're taking very seriously. Now the question is, what are we going to do about that? And there are a number of things that one can do in order to blunt it. If you look at the curves of outbreaks, you know, they go big peaks and they come down. What we need to do is flatten that down. That would have less people infected. That would ultimately have less deaths. You do that by trying to interfere with the natural flow of the outbreak. As a nation, we can't be doing the kinds of things we were doing a few months ago, that it doesn't matter if you're in a state that has no cases or one case. You have to start taking seriously what you can do now.
Are you in an environment where you can telework? Are you planning on going to large gatherings like church? Do you live in a community that is being particularly impacted by the coronavirus? And you can find out this information from your state or local health department. Does your state have a hotline that you can call into to help you assess symptoms? And we have really leaned into coronavirus.gov. Please send people to that website. We've put the tools on there for individual groups, specific audiences, so that people can understand how to stay safe. If we follow this prescription, we will overcome the coronavirus. As Dr. Fauci said, we will see more cases. Unfortunately, we are likely to see more deaths. We have not hit the peak of this epidemic quite yet, but if we follow this prescription, then we will decrease the number of people who are impacted, we will decrease the number of people who will die, and we will more quickly get to the end of this situation.